Motor symptoms are the cardinal signs of Parkinson's disease, and generally with treatment they regress, they improve a lot in the first few years. But as disease progresses, the effectiveness of the levodopa therapy tends to become a bit shorter. And people with Parkinson might experience during the day periods of reappearance of motor disability. In general, based on what patients say and our clinical experience, it is primarily the reoccurrence of bradykinesia, tremor, and also the appearance of gait problems, which might affect balance and lead people with Parkinson to falls. So these are symptoms which have a strong impact on functionality of the person and make people quality of life quite bad if they are present. Symptoms related to motor disability are present already from the beginning, but they improve once levodopa therapy and dopaminergic therapy more generally is established. During the off periods that people with Parkinson start experiencing at the beginning, they are relatively mild, but as disease progresses, the off-related disability increases, and people with Parkinson start having a strong impact on their independence related to the reappearance of this kind of disturbances. The severity of the off in general tends to become worse with the disease progression, but the functional impact of the off may be quite disabling even at the beginning. If you are a person who is active, working, maybe you will be impacted even if you have a limited gait and balance problems, or if there is some tremor reappearing. These people may feel embarrassed to go out for dinner and they would like rather to stay home. So even if the severity of the off periods tends to aggravate with disease progression, it is important to address them timely at the beginning, because the functional impact of these symptoms depends a lot on the expectation of the person, and they have a strong impact already at the beginning on the activities of daily living. Already at the beginning, when we established dopaminergic therapy, people improve in their mobility. So dopaminergic therapy in general is what should be done to control them. The problem is that the effectiveness of levodopa tends to become shorter and shorter with disease progression. And at some point it gets down to 2-3 hours. And if you don't combine with levodopa tablets some other medications that can prolong and extend the efficacy of levodopa, then it becomes almost mandatory to experience these conditions. So optimization of levodopa therapy is the strategy that should be implemented in order to control these symptoms effectively. In a survey we did in Italy a few years ago, we used a questionnaire to look at the presence of off-related symptoms in people with Parkinson. And we did ask the same questions also to the doctors who were treating these patients. Well, we found out that many times at the beginning of the disease there is a large discrepancy. So patients experience features that they don't not immediately associate with the presence of off, but the doctor is often unaware of the existence of the symptoms. So it is important that during the doctor interview, during the doctor visit, the neurologist spend some time asking the patients about the presence of specific manifestations which could be related to the loss of efficacy of dopaminergic therapy, and addresses them properly and timely, because at the beginning they are not easily identified. And since we have effective strategies, I think it is very important that this is done already within the first few years of the disease, without waiting till the end phases when symptoms become more severe.